Hey there, Wellness Warriors. Welcome to the Anchor to Wellness Show, your compass in the sea of holistic health. I'm Kacey Wallace, and I'm your passionate advocate for vibrant well-being. And after witnessing countless patients caught in the cycle of sick care model, I became really disenchanted with the conventional healthcare system. It's a system where people aren't truly getting better, they're just simply managing symptoms. But I refuse to accept this as the norm, and I'm determined to shift the paradigm from sick care to well care. I have embarked on a journey into the realms of functional medicine and holistic health, and in each of these episodes, we will dive deep into the latest research, debunking myths, and unlocking the secrets to optimal wellness. From brain health to hormone balance, we'll cover it all with a blend of science, soul, and a dash of controversy. Together, we're making waves to reclaim control of our health destiny and anchor ourselves to wellness. So whether you're seeking clarity on brain fog or ready to reclaim your vitality, you're in the right place. So let's make waves and set sail towards a life anchored in wellness.
Today, we're diving into a critical theme. We're going to embrace change, and we're going to do things differently to achieve better health outcomes. Many of us have been conditioned to believe that sticking within the confines of the conventional healthcare system will eventually lead to improved health. I'm not against the conventional healthcare system. I just think there's another way if you're really wanting to gain ground in your wellness. There is a misconception that often keeps us trapped in a cycle of treating symptoms rather than addressing root causes. In this episode, I'm going to explain why it's essential to break free from this mindset and challenge these traditional approaches. We're going to explore alternative options and take a proactive stance in our health journey. We can pave the way for true wellness and lasting well-being. It's time to think differently and act differently and ultimately feel differently. But just remember, to be different, we have to do different. So let's get started. The first area I want to talk about is there are some limitations and shortcomings in the traditional healthcare system. The conventional system is primarily designed to manage symptoms rather than address the root cause of illness. And this approach often leads to a cycle where patients receive treatments that temporarily alleviate their symptoms without resolving their underlying issues. For example, a patient with chronic pain might be prescribed painkillers without really investigating potential sources of their pain, such as like inflammation or nutritional deficiencies, hormonal changes, or even their past emotional trauma. This symptomatic treatment model can result in dependency on medications and recurrent visits to healthcare providers without significant improvement in overall health. This system tends to overlook the interconnectedness of bodily systems. A patient experiencing digestive issues might not have their symptoms linked to their stress or their diet or their hormones because conventional medicine often focuses on one symptom or one organ in isolation. This fragmented approach can really delay effective treatment and prolong suffering, leaving patients frustrated and feeling somewhat hopeless. Insurance regulations and guidelines significantly restrict the scope of care that healthcare providers can offer. These regulations are designed to control costs and standardize treatments, but they often do so at the expense of personalized comprehensive care. Insurance companies typically reimburse for specific procedures or tests and treatments that fit in their predetermined criteria. And this can prevent doctors from ordering comprehensive tests that might uncover underlying health issues or from spending necessary time to thoroughly understand a patient's unique health profile. Many times I order testing for patients that insurance doesn't recognize as medically necessary, such as looking at a more in-depth thyroid panel or checking insulin levels instead of just a glucose level and an A1C to really know more about metabolic concerns. And when I order these tests using insurance, certain tests are often left off and the patient has to sign an advanced beneficiary notice that they will have to pay if their insurance doesn't pay. And unfortunately, they will be stuck for this absorbent amount when the test actually only cost a few dollars. Wellness-focused services such as nutritional counseling, stress management programs, and preventive therapies are often not covered by insurance. Patients seeking these services may have to pay out of pocket, which can be a significant barrier. As a result, many individuals are unable to access this full range of care that they need to achieve their optimal health, and that further perpetuates a reliance on reactive rather than a proactive approach to healthcare. We also kind of live in more of a sick care versus well care model. The current healthcare model operates predominantly as a sick care system, focusing on diagnosing and treating illnesses as they arise. This model contrasts sharply with a well care approach, which really prioritizes preventive measures and maintaining health before problems occur. Sick care emphasizes acute care and managing chronic diseases, often through medication and surgical interventions, whereas well care involves lifestyle modifications, regular screenings, more in-depth testing, and more holistic treatments that are aimed at actually preventing diseases. Navigating this system can be challenging for those seeking a holistic approach to health. Patients interested in integrative medicine, which combines a conventional and alternative therapy, often face skepticism from their traditional healthcare provider. Additionally, the lack of insurance coverage for these more holistic treatments can dissuade individuals from pursuing these options. And this dichotomy between sick care and well care underscores the need for a paradigm shift in how we approach health, advocating for a model that supports long-term wellness and preventive care. So I want to talk more about an introduction to holistic healthcare. I believe holistic healthcare is an approach that treats the whole person rather than focusing solely on isolated symptoms. This philosophy recognizes that physical health is intricately connected to mental and emotional and spiritual well-being, and considering the body as an integrated system, holistic healthcare often aims to address the underlying cause of illness rather than just alleviating immediate symptoms. This method encourages patients to engage actively in their health journey, fostering a deeper understanding of their bodies and promoting long-term wellness. A holistic approach also emphasizes the importance of the patient's lifestyle and environment and personal choices in achieving optimal health. And rather than a one-size-fits-all treatment plan, holistic healthcare practitioners work with patients to create individualized strategies that incorporate diet, exercise, stress management, or other lifestyle modifications. This becomes a very comprehensive, personalized approach that can lead to more sustainable health outcomes, and it really empowers individuals to take charge of their health and make informed decisions. Health is not merely the absence of disease, but a dynamic state of complete physical, mental, emotional, and spiritual well-being. Recognizing this, holistic healthcare views health as a multifaceted journey that requires a balanced approach to all aspects of life. Physical health is supported by proper nutrition and regular physical activity and adequate rest. Mental and emotional health are nurtured through positive relationships and stress management techniques and mental stimulation. Spiritual health is often bolstered by practices that foster a sense of purpose and connection, such as meditation, mindfulness, and community involvement. This broad perspective helps individuals understand that achieving true health involves more than just medical treatments. It requires a commitment to nurturing all aspects of one's life. It's kind of hard work, but this is why we're doing different to be different. By addressing mental health issues and managing stress effectively and finding meaningful ways to connect with others, individuals can create a foundation for long-lasting health and resilience. This comprehensive approach helps prevent chronic diseases, enhances quality of life, and promotes a sense of well-being and fulfillment. Holistic healthcare encompasses a variety of alternative healthcare modalities, each offering unique approaches to prevention, diagnosis, and treatment. Functional medicine, for example, seeks to identify and address the root causes of disease by examining the interactions between genetics and hormones and gut health and environment and lifestyle. This approach often involves comprehensive testing and personalized treatment plans that include dietary changes, supplements, and other lifestyle modifications really tailored to each individual need. Integrative medicine combines conventional medical treatments with complementary therapies like acupuncture and chiropractor care, massage therapy, reflexology, craniosacral, and sometimes herbal medicine. This approach aims to provide the best of both worlds, utilizing evidence-based treatments while also addressing the patient's overall well-being. Things like yoga and meditation and energy healing focus on balancing and harmony within the mind and the body. This practice can help reduce stress and improve emotional clarity and enhance physical health. By exploring these alternative modalities, patients can find treatments that resonate with their personal beliefs and health goals. This personalized, proactive approach to healthcare encourages individuals to take an active role in their health, leading to more effective and sustainable outcomes. Embracing holistic care really empowers you to move beyond symptom management and towards a deeper, more comprehensive understanding of your health. So I also believe we have to do some shifting of our mindset. We have to address some misconceptions and fears. One of the significant barriers to embracing alternative healthcare approaches is the misconceptions and fears surrounding them. Many people worry that stepping outside the conventional medical paradigm means rejecting science or that alternative therapies are not evidence-based. These fears are often fueled by a societal stigma and a lack of understanding about the rigorous research supporting many of these holistic practices. It's essential to recognize that holistic healthcare is not about diminishing traditional medicine, but about integrating a variety of approaches to address the root causes of health issues and promote overall well-being. There is often a fear of the unknown and the unfamiliar. Conventional healthcare has been the standard for so long that any deviation from it can seem risky or unconventional. However, many alternative therapies such as acupuncture and herbal medicine and functional nutrition have centuries of use and modern research backing their efficacy. By educating ourselves about these therapies and understanding their benefits, we can overcome these fears and make informed choices about our health. I also believe that in order to be different, do different, act different, feel different, we might have to challenge some societal norms and preconceived notions. To truly embrace a holistic approach to health, it's really crucial to challenge these societal norms and these preconceived notions about wellness. Society often equates health with the absence of disease and relies heavily on medications to manage symptoms without addressing underlying causes. This mindset can lead to a cycle of dependency on these pharmaceutical solutions and a neglect of preventative care. Breaking free from this paradigm requires a shift in perspective, recognizing that true health involves a proactive and integrative approach. So I challenge you to question the status quo and explore different avenues for achieving health. This can be so empowering. It involves understanding that wellness is a dynamic and multifaceted journey. It's not just a destination. And we have to embrace a mindset of empowerment and self-advocacy. We can seek out information. We can ask critical questions. We can find healthcare practices that resonate with our own values and goals. This shift in mindset allows for a more personalized and effective approach to health overall, and that one that prioritizes long-term well-being over short-term fixes. Taking ownership of your journey is a powerful step towards achieving lasting wellness. This can involve recognizing that you have the right and responsibility to make informed decisions about your healthcare. Empowerment comes from knowledge and by educating oneself about different health practices and asking those questions and seeking out a really supportive community around you. I want to empower you to make decisions aligned with your values and goals. And that can mean that you need to find tools and resources to explore more holistic health options. It's about creating a supportive environment where you can feel confident in your ability to advocate for yourself. And this might be about learning about nutritional therapy or other holistic practices like things like craniosacral work or reflexology. And by taking this active role, you can really move beyond being a passive recipient of care to becoming proactive in your own well-being. I also want to go and redefine a little bit about health and wellness. I want to look at health beyond the absence of disease. Health is often mistakenly defined as simply the absence of disease or illness, but this narrow perspective overlooks the true essence of well-being. Optimal health is a dynamic state that encompasses physical, mental, and emotional well-being. It involves not just being free from ailments, but thriving in all aspects of life. The holistic view of health recognizes the interconnectedness of the mind, body, and spirit, and the importance of achieving balance and harmony in all of these areas. By bracing a broader definition of health, we can better understand what it means to truly live a healthy and fulfilling life. Optimal health is characterized by vitality and energy and a sense of purpose. It means having the resilience to cope with your challenges in life and the capacity to enjoy life's pleasures. When we redefine health in this way, it shifts our focus from merely avoiding sickness to actively pursuing a lifestyle that supports overall well-being. This approach encourages a proactive stance on health where you can take steps to nurture your body and mind through those holistic practices and those lifestyle shifts and making meaningful connections with others. I also think about focusing on underlying imbalances and how this can help really change our mindsets. Rather than fixing on diagnoses and labels, it can be crucial to address these underlying imbalances that contribute to health issues. Traditional healthcare often emphasizes diagnosing a specific condition and prescribing medications to manage symptoms, but this approach can overlook the root causes of illness. True healing requires a deeper understanding of the body's innate healing capacity and identifying the factors that disrupt its imbalances. This might include nutritional deficiencies, hormone imbalances, chronic stress, environmental toxins, gut health issues, previous trauma in your life or current trauma in your life. There's so many things that can be addressed to really help that innate healing capacity. By focus on these underlying imbalances, we can support the body's natural ability to heal and prevent disease. This involves comprehensive assessments and personalized care plans that consider the unique needs of each individual. For instance, instead of merely treating high blood pressure with a medication, we would want to explore more things like diet and stress and lifestyle habits that can be contributing to this. Addressing these root causes not only alleviate these symptoms, but also promote long-term health and resilience. I also want to look at prioritizing self-care and preventive measures. To achieve true health and wellness, it is essential to prioritize self-care. Self-care is not a luxury, but a fundamental aspect of maintaining health. It involves practices that nourish the body, mind, and spirit, such as regular exercise or healthy eating, or looking into things like visualizations and mindfulness, going and taking care of yourself in a way you would like to, taking a bath every night and reading a book, whatever that looks like for you. Making self-care a priority can create a strong foundation for overall well-being and resilience against illness. We want to really think about redefining health to include optimal physical, mental, and emotional well-being. So addressing these things like these imbalances and prioritizing self-care and even focusing more on preventative measures, we can cultivate a more comprehensive and effective approach to achieve lasting health and wellness. In this episode, we have looked into the critical need for embracing change and doing things differently. To be different, to feel different, we have to do different, right? We explored the limitations of the current healthcare system, how it mostly focuses on symptom management, but we want to really look at addressing root causes. We discussed the importance of looking more holistic healthcare. It treats the whole person and views health as a multifaceted journey encompassing the physical, mental, emotional, and spiritual well-being. We examined the necessity of shifting mindsets to challenging traditional approaches and exploring alternative options for achieving optimal health. It's essential to recognize that true healing requires a willingness to break free from the constraints of the current situation in healthcare. This system often is bogged down by insurance regulations and a narrow focus on disease management. It can hinder individuals from accessing the comprehensive wellness-focused care that they need. By embracing these approaches to health, you can take proactive steps towards creating a life of vitality and fulfillment. We can address underlying imbalances and prioritize ourselves and make informed decisions that align with our values and health goals. I encourage you to explore other healthcare options such as functional medicine or integrative medicine or other alternative therapies like we've already talked about, like reflexology and craniosacral. These are wonderful modalities for healing. These approaches prioritize prevention, root cause analysis, and individualized care, offering a more comprehensive and effective path to health and wellness. I want you to join the movement towards a more integrated and holistic approach to health, where the focus is not just on managing symptoms, but on achieving lasting wellness and resilience. Remember, achieving different outcomes in your health and well-being requires a willingness to do things differently. Challenging societal norms, empowering yourself with knowledge, taking ownership of your own health journey can really break free from this. So by doing so, you break free from those limitations of the healthcare system. You move towards a more vibrant and healthy and fulfilling life, and you can gain ground in your wellness. Thank you for joining me on this episode of the Anchor to Wellness Show. Together, let's anchor ourselves to a life of vibrant well-being. Until next time, take care, stay curious, and embrace the journey to holistic vitality. Stay anchored and stay well.